I'm opposed to repealing the Climate Commitment Act.
The problem with the gas tax is we weren't told the truth.
That was from last night's governor's debate on King 5 when we asked both candidates about Initiative 2117, which will determine the future of the Climate Commitment Act. Signed into law in 2021, it's Cap and Invest program that limits carbon emissions from businesses. If they go over, those businesses have to pay. 2117 is on the ballot, which would repeal the program if approved. Brian Haywood sponsored Initiative 2117 and says costs are being passed on to drivers at the pump.
Is this good for the environment, or is this hurting me at the gas tank? And the truth, I think, is it's a money grab that's wrapped up like it's going to do something for the environment.
A poll conducted in partnership with King 5, the Seattle Times, and the University of Washington Center for an Informed Public shows 18% of Washington voters are still undecided about repealing the program. 48% of respondents said they would vote yes on Initiative 2117, while 34% said they expect to vote no. Among those who want the Climate Commitment Act to stay in place is Dr. Vin Gupta, a medical analyst for NBC and pulmonary physician at the University of Washington. Dr. Gupta, thanks for joining us.
Thanks for always having me.
So repealing the Climate Commitment Act, you say, would have some negative health implications. Can you explain that for us?
Well, Joyce, this is critical that we're talking about this to Washingtonians right now, because we have to understand the true costs of 2117 and their health. They're directly related to health. I know something about this. I'm talking to you from the four walls of an ICU here in downtown Seattle. And the proponents of 2117 don't really know what they're talking about when it comes to why that we should be moving back or why we should be really saying yes to 2117. They have no clue what they're talking about when it comes to the health impacts here. That's why I'm saying no on 2117, that it's a bad deal. But why, to your question? Well, number one, it is going to worsen air quality across our state. And Joyce, the University of Washington has put out study after study that's shown that air pollution is an independent risk factor that's growing for death and disability worldwide, especially here in Washington state that's prone to wildfires, smoke across our state. And it's going to end air pollution mitigation efforts very clearly. And that's a big deal, especially in a time when air pollution, air quality is, again, an independent risk factor to our lung health and our heart health. That worries me. I'm caring for patients right here that have underlying lung disease, that have underlying heart disease. They're going to be worse off as a result of this initiative if it goes through. Wildfire smoke mitigation, Joyce, that's also going to become less of a priority here. We're going to increase the risk of wildfire smoke exposure every single summer. That's not a good thing for the health of Washingtonians. It's going to devastate our transition to electrical vehicles. We know that diesel school buses and their exhaust, Joyce, is one of the biggest risk factors for lung cancer in the state of Washington. It also increases the risk of childhood asthma. The money that is needed to do that transition is going to go completely away if we don't invest in it. And lastly, HVAC systems. We know we need clean air in schools and other buildings across Washington state. It needs that money to move HVAC systems into the modern era to protect our air, to protect the air that we breathe. This is what the Climate Commitment Act does. That's why I'm saying no to 2117 for your health. It's really important.
You talked about HVAC systems, air filtration systems being especially important in school. Money from the Climate Commitment Act is supposed to be spent on these kinds of things, environmental and climate-related projects. And a lot of people want to know, is that happening? Where is the money going?
Yes, we're seeing the impacts of it. I was just yesterday actually at a youth facility in West Seattle, where they are trying to upgrade their HVAC systems using funds from the Climate Commitment Act. We're seeing this across our state. If we're suddenly to say we're going to repeal these efforts, all that in the way of resources suddenly goes away. And why does that matter? For all your viewers out there, we live in a world of multiple threats to our lung health, to our overall health. One, we're talking about air pollution, air quality. Of course, what's happening outside impacts the air quality indoors. That's why HVAC system improvements are important. Air filtration, bringing it into the modern age, cleans the air around us. It's good for our lung health. Joyce, is good for our brain health. But number two, outside of air pollution from, say, wildfire smoke, we know that we're under the constant threat of infectious disease. So this is going to tackle both infectious disease risk and also the risk from air pollution, wildfire smoke. We cannot afford in this moment where there's health threats all around us suddenly to go backwards.
Dr. Vin Gupta, we are out of time. Thanks for your time tonight. We appreciate it.
Thank you.